muscle and burn fat. EMsculpt is a non-surgical procedure that takes 30 minutes and it's like doing 20,000 crunches. And in only 4 30-minute treatments, I found results. Come see Dr. John Mendelson and see what EMsculpt can do for you.
Hello and welcome back to our 10th episode of Let's Have Lunch during this coronavirus stay here in Ohio, around the country. Hope you are doing well, hope you're healthy. We hope to be back to work officially today or tomorrow. I think that was the original stay here. Anyway, overall it does look like there's maybe some optimism here as some of the parts of the country, including Ohio, maybe seem to have peaked. We sure hope so. In the meantime, we're eager to get back. Today, though, we're joined again by Karen Whitney, by Hope Merz, and by Karen Lynch. And today I thought we would talk about some of the non-surgical treatments. I know, first of all, not being able to get to the gym can be a bit frustrating during this time. I kind of like the structure and the regimen that I had. But we're going to talk about a couple of procedures that are popular this time of year anyway. One is CoolSculpting for reducing extra fatty tissue around the body, and the other is EMsculpt, which is a newer treatment over the past year or two that really is pretty wonderful, and along with EMsella. So we're going to talk about these treatments and a few other things with Hope and Karen. So with that, I'm going to go ahead and turn it over to Hope and Karen. Hope, I think you're going to first start talking about CoolSculpting, is that correct?
Yes.
Okay, go right ahead. Take it away.
Okay. So there are various methodologies for non-surgical body contouring. It's a common concern amongst many people, especially getting into this season when we're going to be wearing less clothes and in swimsuits. And especially that we're kind of stuck at home without the ability to go to our gyms and all of that kind of thing. We might need to do a few non-surgical options to catch up. So one of those methods is called CoolSculpting. CoolSculpting was approved in 2010 for the flanks, the hips, the side of the torso. And then it was approved in 2012 for abdomen fat reduction. And what this does is it freezes the fat cells. So CoolSculpting is a mechanism with a handpiece that's about this big. We attach this handpiece to a pinchable area of fat. That handpiece will pull some of the fat in it. It'll suction a bit of fat into that handpiece, and it will reduce that temperature to about 40 degrees Fahrenheit, where fat cells will freeze, but no other tissue is going to be injured. And those fat cells will send themselves into something called apoptosis, where it's just a natural cell death. And those fat cells will be eliminated over a 2-month period of time through the lymphatic system. So you basically just urinate them out in a couple of months slowly. It is such a slow process that the skin does tend to rebound back, and it gives a nice result. You can expect about 20% reduction of fat in the area that is pulled up. And I like to compare that to about the size of a butter stick. So the ideal candidate, it's a very common question, who is CoolSculpting for? You want to be in a healthy weight range, and you want to have just a little bit of a pinchable area of fat. And that is what CoolSculpting is great to treat. So typically we'll treat you one time, and then we'll have you come back in 2 months and we'll assess the results of that first time. You may be happy. People typically do want 2 treatments. So we'll usually treat again at that 2-month period, and then we can follow up again 2 months after that and see how your results have come along. But it's a great option. I did CoolSculpting prior to my wedding years ago, and it really helped just smooth the front of my abdomen to look better in my wedding dress. And so it is a great option if you're the right candidate. And we will look at you in a consultation, and we'll look at your abdomen or wherever we're treating, and we'll make sure that that treatment is right for you. There's multiple other options, which Karen will go into a little bit more for non-surgical, but CoolSculpting is a great one for those pinchable areas of fat. So Karen, let me know if I forgot anything, but.
So Hope, let me just ask you this. So with cool sculpting addresses fat. Does it tighten skin, or does it do anything to the muscle?
Okay, so cool sculpting is only going to address fat. So the skin does tend to rebound a little bit because it's a slow process of elimination of fat cells, but it is not going to tighten any skin. So if you do, say you had twins or you had a pregnancy that really left you with that extra loose skin, sometimes we do need a surgical option to treat that, to remove the excess skin. But really, cool sculpting is not going to be what you want to choose for skin. It treats fat only, and it doesn't build any muscle like the EMsculpt would.
Okay, great. Thank you. But there is something that might help a little bit more with the muscle. I think you're going to share that with us.
That's correct. So I'd like to talk about EMsculpt. You might have heard about this treatment. The M in the name of EMsculpt stands for electromagnetic. And the EMsculpt treatment itself uses high intensity focused electromagnetic energy to cause a super maximal contraction. So you think about being in the gym and doing a crunch or a sit up. Of course, you're tightening your abs in order to accomplish that. And you know, during a workout, they'll work on the upper abs and the lower abs, and it's hard to do something that catches that entire abdominal rectus muscle. Well, with EMsculpt, you're getting a super maximal contraction of the entire front of the abdominal muscle wall. And the way this treatment works is that you come in, you're wearing comfortable sweat clothes or gym clothes. We don't want metal buttons or zippers on you. We're putting one or two paddles, which are about this big around, onto the abdominal wall, and we're using Velcro to strap that paddle onto you. So you're laying comfortably on your back. You might have a little pillow under your knees. You take your iPhone off, you take off any jewelry, put the electronics and metal aside. Then we gradually increase the energy of the EMsculpt device. And at first, very low energy feels like a buzzing. Then you'll start to feel the abdominal muscles contract, and we'll take it up to the highest energy setting that's comfortable for you. It feels funny at first. It's not painful. It is a muscle contraction, but it's just the abdominal wall, not your insides. And we'll take it to the point that that muscle is contracting, and you can see and feel the contraction for all the way up by your rib cage, as well as all the way down by your hip bones and your pubic bone. So this entire muscle is tightening and then relaxing. So there's a treatment pattern programmed into the device, and it gives you a pattern of treatment where it'll pulse, relax, pulse, relax, pulse, relax. Then you'll feel a vibrating or pounding type pulsing. So it has a particular protocol it follows. During this time, you're just laying relaxed and comfortable. It's not painful. It's a funny sensation. Some people actually will feel the rest of their body come up a little bit during that contraction if it's tight enough. Some people do generate some body heat during this treatment. I think that's more a larger built individual where we have one paddle on each side of the abdomen, but you're just simply laying there and relaxing for 30 minutes. During this time, the physiologic effect of the magnetic stimulated contractions is comparable to doing 20,000 crunches in a 30-minute time, which of course is totally impossible for us to do. But the point is, we've all been away from our normal routines, away from the gym, away from the workout. We feel like we've got some catch up to do perhaps. We know that summer is coming. How do you get the best abdominal muscle tone that you can? Well, you can let EMsculpt assist you. So the treatment protocol is that you do you do 4 30-minute sessions. Usually we're doing them twice a week, and we want to do twice a week for consecutive weeks for the best result. The EMsculpt device has 2 different size paddles so that we can treat abdominal muscles for tightening and reducing that stubborn abdominal wall fat. We can treat and lift the glutes. So we're getting kind of a non-surgical type of butt lift by tightening and firming the glutes. We can use this on your thighs, on your calves, as well as on your biceps and triceps. So really any muscle area of your limbs trunk that you want to treat, we can focus on. Each of those protocols is a 30-minute treatment twice a week for a 4-week session. You do see results after a couple of treatments, and the effect really, when they did the clinical studies at 6 months, the impact was even sustained and even a little bit better. So on the abdominal wall, there was about a 20 to 25% decrease in abdominal wall fat and increase in abdominal muscle thickness. On the glutes, lifting and firming of the glute muscles. Trying to think what else is important. So who's an ideal candidate for EMsculpt? This really is kind of designed for that person who's already fairly pretty much in their ideal body weight. We're not really using this for bulk fat reduction, but more for toning, firming, refining someone who's close to their fitness goals, probably is already working out at the gym or trying to work out at home, and has some pinchable fat on that abdominal wall, but not a lot of bulk that we're trying. If somebody has a little more fatty tissue there, we're going to do CoolSculpting first, debulk you a little bit, and then move over to EMsculpt to get the muscle strength. So this really appeals to people who have already been doing yoga, Pilates, working out at the gym, maybe a walking program, and they want to build more muscle. It's that person who is typically doing something and trying to boost the results, because of course no one can do 20,000 crunches at any time, much less 100 or 50, So it's a great treatment option. Like CoolSculpting, EMsculpt has zero effect on the skin. You're not going to see the skin look saggier, creepier, droopier, because we're not making a large volume change. We're really tightening and firming the underneath structures. Hope's going to talk a little bit about what you can do for actual skin, but it is important to know that if you have looser abdominal skin because of pregnancy or weight loss, it will not tighten that skin. And sometimes I'll see patients who are interested in CoolSculpting or EMsculpt, and really they just have a little bit more fatty collection goodness than might be ideal for these treatments. And in those cases, we have you talk with Dr. Meyer, our body specialist, to consider liposuction. That will accomplish removing larger volumes of fat at one treatment. And so sometimes that's an option as well. But we see so many patients who want a non-surgical treatment option to improve their contour, their shape, their overall health. And I love EMsculpt because it gives you muscle strength as well as reducing fat.
Hey, Karen, can you just comment? I think you had a little surgery last year, and you used EMsculpt. You were talking about yoga and Pilates and maybe core and toning, but maybe share your experience with that.
Yeah, those of you who know me might know that I had a hip replacement last January. And the real problem was that in the 2 years leading up to the hip replacement, I couldn't help but favor that painful hip. And I was watching my quadricep on my right thigh get smaller and smaller. And I couldn't do squats. There were a lot of things I couldn't do to strengthen that muscle. So I used EMsculpt on just my weaker thigh, and literally it beefed it right back up to where it was even strength, even bulk, so that once I had my surgery, I was in a much better position to resume my regular exercise routine. I also used it on glutes just for the same reason. I wasn't doing as much as I was accustomed to. And I really felt like it helped propel me to a level of fitness I couldn't accomplish on my own because of the hip pain.
Yeah, I thought that was great. I think I don't recall, but I think you were measuring your thigh just to see. It's kind of like a pre-rehab sort of thing.
It was. I was prehabbing for
Right.
sure.
That I think you started off in a pretty good shape. So Karen, can you also talk a little bit about the technology that's used? I know we're shifting gears away from the abdomen, but with EMsculpt a little bit, so that maybe you can share how the technology is being used elsewhere.
Yes, so that high energy, intense focused electromagnetic energy is also being used on the pelvic floor muscles because urinary incontinence and pelvic floor weakness is such a common problem. Almost everyone knows about the Kegel exercises, which is where you're manually on your own, you're tightening your pelvic floor muscles. They're hard to do. It's hard to do enough to get the results. I know that physical therapists are now actually working with patients to teach them how to do these exercises effectively. So EMsculpt refers to electromagnetic energy of a chair. Sella is chair in Italian. And so for women with pelvic floor, and actually men with pelvic floor weakness, the EMsculpt is a chair-like device. It's got a flat surface. You sit on it with your clothing on, and we gradually turn that electromagnetic energy on. And at first it feels like a little buzzing, and then you will feel the pelvic floor muscle contracting. And these are also 30-minute sessions. We typically do 6 in a treatment protocol. And we're using this to treat stress incontinence, meaning you cough, you sneeze, you laugh, and you have some urine leakage, which is very, very common of all ages, both before and after childbirth and as the aging process goes on. So it is FDA approved to treat stress-related urinary incontinence. A lot of times women will have a mixture, some stress, some urge incontinence, and surgery is the only option besides doing Kegels. So we're using EMsculpt. Almost everyone, I can't think of any patient who's been on EMsculpt chair, did her series of treatments that was not pleased with the results. Depending on the severity, you might need more than one round of treatments, or you might find that it's helpful say for a year, and then you come back and do some booster treatments. So these are both exercise treatments that can be repeated or increased in their number for greater effectiveness. And yeah, we've been happy with EMsculpt because it gets great results. The patient doesn't have to do anything, and it's totally painless and non-invasive.
Well, thank you very much. Okay, good. So should we have Hope come back here? And I think Hope was going to talk a little bit about microneedling, RF. Go right ahead.
Sure.
Thank you.
So another question that we get a lot of the times, and a very common concern amongst many people is the skin on the body, and what options do we have for the bat wing or the lines above the knees that kind of gather in that horizontal fashion around the knees or around the elbows. We've used a lot of different mechanisms for skin tightening over the years. And last year, we've had over a year the microneedling with radio frequency. So this machine utilizes 2 different technologies combined, and really I believe is the best yet for skin tightening. And it combines microneedling with radio frequency. So the microneedling is a way to introduce tiny little micro injuries into the skin. What that does is it triggers a cascade of healing by the body, which triggers collagen and elastin to stimulate and tighten over time. And then also, once the microneedles are in the skin, a little quick tiny burst of radio frequency energy, which is a heat energy, is released, and that causes an immediate contraction and tightening of the tissue, as well as further stimulation of the collagen and elastin. So typically we recommend 3 treatments to an area. One area might be the knees and right above the knees. One area might be the elbows and right above the elbows. And we'll usually recommend 3 treatments 1 month apart or so, 4 to 6 weeks apart. And we do get an improvement in the skin laxity. So patients are happy. I know I'm treating someone's hands, and we of course do neck, face, and chest with that, but it can be useful on the body as well. So that's an option for anyone trying to get a modest improvement in skin laxity or trying to just prevent for future aging.
You hope? Okay.
Sure. I thought I froze there for a second.
No, I lost. Okay, well, do you guys have any other comments about anything else? Any other questions or thoughts that you guys would like to share?
I do have one addition to partnering with microneedling or without, but using the Elastin Restorative Skin Cream. It's a body firming cream, and it's meant to be used once or twice a day on an area that is showing laxity. Also, if you've had EMsculpt or CoolSculpting, it helps speed up the transition of dead fat cells out of the area, so you see results sooner. And a lot of our patients have seen nice improvement in their skin using this product.
Yeah, and very good point. I think that we did send out a note to patients who were scheduled with us for the month of April, and there have been other requests. We are partially open for business, and that is curbside skincare. So for anybody who needs those are products, that is not curbside skincare treatments. All you need to do is contact the office, and we will arrange things accordingly so that you're not interacting with anybody, but that you can pick up your Elastin products or other products for that reason. Karen Lynch, any thoughts?
No, I think you covered it. I really liked EMsculpt. I had great results with it, and I also did CoolSculpting a few years ago. So both treatments worked great for me.
I think I need to get back on the EMsculpt this month here with sitting around eating too much chocolate. But anyway, okay. Well, thanks everybody for tuning in. I appreciate you guys coming back. Tomorrow we'll be back at noon again, and we'll see you then. Bye.
Bye.